I'm here with Bonny Specker, epidemiologist from South Dakota State University, who is going to give us an update today on what has been happening with COVID-19 in our region, in the state, across the United States, and in the world. And before that, she's going to talk to us about Epidemiology 101, rates and trends. Bonny, what are rates and trends, and what has been happening?
Well, I'd like to start off with just some information on rates, because there seems to be a lot of confusion. A lot of people don't understand why we put numbers on a per 1,000 population or 100,000 population basis. And I thought I would just go over that. We did this in a previous one, but I've added a couple other things and I've updated some of it. But here we have 4 people, and I'm talking about counties right now because later on I want to go over the rankings for the top counties with the 10 most populous cities and talk about some rates there. But if we have 2 counties, County A and County B, and both of these counties have 4 sick people, say 4 people with COVID, it's really hard to say anything about those 2 counties unless we knew how many people were actually in the counties. So in this example, County A has only maybe 10 people, whereas County B would have 100 people. And you can just see, looking at this, that County A is going to be much more affected by these people being sick than County B is, because it's a much larger percent of their population that's sick than what you see in County B. So it's the exact same numbers of cases, both of them. There's 4 people that are sick, but the rate in County A is going to be much larger. It's going to be 4 divided by 10, the population of that county. Whereas in County B, it's going to be 4 divided by 100. So it's the difference between 40% and 4%. Which is a pretty big difference, even though the number of cases are exactly the same. And here are some examples, and I've drawn out these states. This is North Dakota, South Dakota, and Minnesota. And people always say, oh, Minnesota has so many more cases than South Dakota. Of course they have more cases. They have a lot bigger population size. Here you have in South Dakota, this is as of yesterday, the numbers, we have close to 86,000 cases. North Dakota has 83,000 cases. Minnesota does have a lot more cases. They have 300 and almost 51,000. But if you look at it by rates, and what we did is we just took this number divided by the population of Minnesota, this number divided by the population of South Dakota, this number divided by the population of North Dakota. Now we have these numbers, and these are the number of cases per 100,000 people. So you can see from these numbers that it isn't North Dakota that has a problem. It's really, it's not Minnesota that has the problem, it's North Dakota. North Dakota has the highest rate of cases than of the 3 states. And Minnesota, even though they had this many cases, they have a much lower rate. So this is giving us information on which state is having the highest risk of having the disease. But if I'm a hospital administrator, and I need to know how many beds I'm going to need to have, this is the number I'm more interested in, right? I'm going to need more beds in Minnesota than I will in South Dakota, but the risk of coming down with this disease is higher in South Dakota than it is in Minnesota. So you look at numbers and rates for different reasons. That, what I showed you previously, were the actual cases. This is deaths, and you can see here that Minnesota has almost had 4 times the number of deaths as South Dakota, but we have almost double the death rate of Minnesota when you adjust for these differences in population size. And some people have said, well, why don't you just give the population size and the cases and let people, figure this out, like see it on their own. So this is what a table like that would look like. Here we have just the 5 most populous cities, and we have the total number of cases here for each of those counties. This is as of yesterday's update. And then here we have the population for those different counties. So we could just give people this information and we can say, okay, there's the information. Now you have to figure out what it means. It's a very burdensome way of looking at numbers to try to comprehend how does this compare to this by looking just straight at the numbers. So what we do is we just divide this divided by this, and that's what you come up with, 0.07327. So these rates let us compare these populations of different sizes with a smaller number. But even this is confusing to people because it's like 0.07327, like what does that mean? Well, I can simply multiply this number by 100,000 and come up with this. And that's what a lot of the websites that are tracking COVID are using, a rate per 100,000. So you see a lot of numbers for total cases over this pandemic in this range. So this is the Brookings versus Minnehaha. So you can see that we've had one of the lowest rates here. Now, there's nothing magical about this 100,000. It can be anything. We can do it as a rate per 100. And so we just take, go over 2 here, and then we'd have these kind of numbers. And this is the same as a percent, right? Some number out of 100 is a percent. So in Brookings County, 7% of the population has had COVID compared to 11% in Minnehaha. Or you could say 7,000 out of 100,000. So it's just a way of making these, adjusting for the population differences, and then having one number that you can look at when you're comparing it to other populations. So that's why we do rates, and I just want to talk about some trends. This is cumulative cases per 100,000 population. So all of these numbers have been adjusted for the different population sizes because we don't want to, as I just said, we don't want to compare like Minnehaha case numbers to Brookings case numbers because they have such a larger population. It's going to be a lot larger. But what we want to know is what's the rate, like how many per population. And this is what you get. Here we have back in April, this increase in cases, and then another little bump here. This was the outbreak at Smithfield. And then this is when they went and screened all of the Smithfield families and friends, acquaintances. Here in Beadle County, people will remember there was an outbreak there at one of the local churches. So we have this big increase here. And these are cumulative cases. So this is the total number of cases over this period of time. We have this blue line going down through here because there were no data posted on Thanksgiving. So that data is missing. But you can see here, Brookings, they passed the ordinance back in early September. And at that time, Brookings is this yellow line. At that time, we were about 5th, right in the middle of the 10 counties in terms of total cases. So the mandate passes here, and people have said, oh, but it didn't obviously work because you still had cases afterwards. And you can see that we did. This line is going up, which means there's more cases being added to it. If it had completely stopped it, we would just be flat. But it didn't. But it did slow it down compared to what was going on in these other counties. If you look at Cottington County, for example, this white line, we were having increases at the same rate as Cottington County. These two, the blue line and the yellow line, are very parallel right here, going up together. Brookings slows down and Cottington continues to increase to where now they're the 4th highest county, whereas Brookings slowed down. And you can see this blue one, Davison County's past them. They're really picking up here. The green one, Lawrence County, it starts picking up as well, whereas Brookings stays pretty low. And you have a lot of these counties that were lower than Brookings before the mask mandate that have now surpassed it. So that out here, we are now have the lowest cumulative number of cases per population size of all top 10 counties. And here I've zoomed into that a little bit more, just showing you that what you're interested in is the slope of this line. Is it steep, like right here, or is it flatter? The flatter one's saying there's very small increases. The steeper this is, the larger the increase. There have been some of these counties that have implemented some sort of mask mandate resolution recommendations, and they are the ones that are in solid lines. So like Davison just implemented something back in here, and most of them are around November 17th, the middle of November, when these cases were really going up. Now this is really complicated, but it's the exact same thing, but here it is not cumulative. So these are the number of cases, the average number of cases per day over the last 7 days, adjusted for population size. So take out the population effect, and we can look at what's happening in all these counties. I mean, the first thing you see is it's highly variable. It's all over the place. You know, some counties are having outbreaks, other ones aren't. Again, you see this big peak in Davison. That's why that slope of the line was so steep in the previous slide. But you can see back here around the time of the mask mandate how the number of cases per day in Brookings decreased for a while. It came back up, but it's not going up. You're not having as many as these other counties are. So yes, we do still have cases, and we did increase, but we did not increase anywhere near the level that the other counties increased. And here is how this is summarized. This is out of the New York Times. This is accessible to everyone. You don't need a subscription. And you can look at all counties in South Dakota, not just these. But this is as of yesterday. We were ranked the lowest of these 10 counties in the number of cases per day over the last 7 days. We have the lowest rate. Yankton right now has the highest. If you look at total cases, this is from the beginning of the pandemic. We are also the lowest. We have 7,000 per 100,000. The highest being Beetle County, that has close to 13,000. And then they also do the same thing for total deaths. And this is the first week that we've actually moved up to having the lowest death rate. I think the last couple weeks we've looked at this, we've been second or third, but we have now come out with having the lowest with a 51 per 100,000 population. Yankton has been in that #1 spot for a while. So that's we just need to keep in that #1 spot. I'm very competitive. I like it when we stay in that #1 spot. So in summary, with these trends and rates, I just think it's important for people to realize that raw numbers are hard to compare between groups of different sizes. And rates are used in epidemiology and a lot of other fields. When you hear like per capita, that is adjusting for population size. And there's nothing magical about it. I mean, all of us in middle school learned all about common denominators, and that's all we're doing is making a common denominator. And expressing these COVID cases and deaths per population size is letting you compare a variety of populations across the common denominator. So it's just making things doable. So that's the summary.
Well, thank you, Bonnie. That is a great way to show us how those rates work. I like to think about it. If I run into 100 different people during the day, how many of them would likely have COVID? And it's nice to be able to see it in that rate rather than just a number, because it really gives you that perspective of, how many people in our community that you would run into actually have it.
Right.
Yep. So what do you have for an update for us today?
Well, it's kind of the good and the bad and some ugly. We still are in substantial spread for Brookings, but things are looking a little better here. I'm just not really, I don't feel real confident for both the state and the county to say that we're definitely doing better, because we still have a high number of susceptible people in our county and in our state. And even though the rates look like they're going down, I think some of that's still a reflection of Thanksgiving last week, because people have come back, they're getting tested, but it takes so many days to get those results back and then get it onto the dashboard. So I'm just being very cautious about what the next 2 weeks are going to bring, the rest of the month, especially with the Thanksgiving travel. We do have 2,594 cases. There were 165 cases this week compared to 175 in the previous week. As of yesterday, there were 438 active cases. That's down from last Sunday when it was 471. 85 people have been hospitalized. There were 6 new admissions this week compared to 5 in the previous week. We had 20 total deaths overall. 4 of those deaths were this week versus no deaths in the previous week. Test positivity, we had gotten that down pretty good. Previous week it was 17 and 9% depending on your denominator. This week it's back up to 38 and 13. We had gotten this down, I think, when SDSU was screening a lot of the students before they went home for Thanksgiving. As far as the state data, you can see it's following like Brookings where it's going down here, but deaths are not really going down yet. We have 85, close to 86,000 cases, and kind of the same, 6,000 cases this week, not quite the same, 6,800 cases in the previous week. There were 16,000 active cases on December 6th, and this compares to 16,930 last Sunday. So a little bit down, but not a lot. 4,835 people have been hospitalized over this pandemic for COVID. There were 367 admissions this week compared to 374 in the previous week. 497 people were hospitalized. 111 of them were in the ICU yesterday, and this is down from 544 last Sunday. As of yesterday, there were 1,110 total deaths. 164 of those deaths occurred in December. There were 167 deaths this week. That was the highest number of deaths in any one week, compared to 124 in the previous week. And the test positivity is inching back up again. If you look at it as the percent of people that were tested, it's at 50%. If you look at it as the percent of tests done, it was at 18%. This is the high school or K-12 and higher ed numbers, and I just added some labels here so that it's a little bit easier than trying to keep an eye on the color of the dots and the lines. But this is the number of K-12 students, close to 6,000 as of last Friday. The higher ed students, we have about 2,600, K-12 staff at 2,148, and higher ed staff at less than 400. The US, this is where we get into the ugly part of things. There have been close to 15 million cases, 1.37 million new cases this week, compared to 1.15 million in the previous week. There have been 287,000 total deaths, 15,000 this past week, compared to 10,000 in the previous week. And if you remember it, this is the actual number of cases each day. And this back here was when New York and New Jersey, the New England states, had that big outbreak in the spring. And a significant percent of those people actually died. We've now figured out how to treat this disease, because it's not new anymore. So people are figuring out what's the best way to manage these patients. And you can see that by this, large number of deaths coming from this peak. And then we have these deaths coming from this peak. And now we're coming out here with another peak. This is the highest number of cases it's ever been. We're breaking records pretty much every day. But the number of deaths are now, getting up to what it was back in the spring when it was so bad in New York and New Jersey. So this is not good. If you look at the world, we have close to 67 million cases, 4.28 million cases this week compared to 4.07 million in the previous week. You can see this again is cases per day, not cumulative cases. And we're getting more and more cases per day being diagnosed. 1.53 million cases, 76,000 deaths a week. That's over 10,000 people a day are dying from this disease. And that's up from the previous week where it was 71,000 in the previous week. And so you can see this is also reaching new heights. And if people ever saw the very first talk I did on the 1918 influenza outbreak, it was very much like this, where you had maybe here in the spring, and then in the next fall, it was like this. And that's what we're seeing again here with these increase in deaths here, going down and then peaking again. As of December 2nd, these are the states that are asking people from South Dakota to quarantine or recommending it. Kansas was actually removed this week from this list, so there is no recommendation or requirement for quarantining if you're going to Kansas. And again, the website, in case you're interested in double checking on this if you're traveling, see what the restrictions are. And now I'm changing my little message here. I mean, I think by now everyone knows what they need to do to get this under control. We just need people to do it. And it would really help get it under control. So that's the update for this week.
Well, thank you, Bonnie. I'm going to go ahead and put the link for that 1918 pandemic presentation that Bonnie did early in the COVID-19 outbreak in the comments, or not in the comments, but in the description of the video. So for those of you that would like to go back and look at that, it's available to you. And if you have any questions for Bonnie about epidemiology, please email us at that email address that's also included in the description, and we'll get those questions answered for you. Thank you so much, Bonnie, for the update. Until next week, have a great week.
You too.